Lisa Hart. Congratulations on your purchase of your new Life Gear Inversion Table. If you're like most people, you're probably looking for a way to reduce back pain, reduce stress, improve circulation, improve your posture, return balance and symmetry to your body, or maybe decompress after a good workout. Now this video will help you to learn more about your Life Gear Inversion Table, and it consists of 4 parts: balance settings, partial inversion, total inversion, and most common questions and answers. Now make sure you read and carefully follow the instructions in your owner's manual before using your Life Gear Inversion Table. In order to test the balance settings of your new inversion table, there are 3 settings that we need to consider. First, the pivot arms. They need to lock into place. And until you become comfortable with your inversion table, it's recommended that you use the pivot arm in the last hole. Next, we need to consider the nylon strap that's at the base of the main frame. Now this can be adjusted for a greater or a lesser degree of inversion. You need to make sure that it is connected firmly onto the main frame there. And when the strap is connected, you won't be able to go totally inverted. Start out with about a 45-degree angle or whatever you feel most comfortable with. Third, make sure the adjustable boom is positioned properly. It has markings on it for inches and centimeters. So if you're 5'4", you'll want to adjust it so that you see actually 5'5". Now once you have all of the settings set properly, you can get started with your new Life Gear Inversion Table. Now the first time that you're using it, it's highly recommended that you use a spotter. Jim's going to help me demonstrate. The first thing you need to do is stand on the instep frame and then pull the spring-loaded pin. Make sure it locks into place to secure your ankles and your feet. Now this is going to support you as you rotate back and invert on the table. Next, lay back and lay your head onto the table and then rest your hands on your chest. Now if the main frame lifts up off the A-frame, you probably have it positioned and balanced properly. Now half your body weight should be above this pivot point and the other half of your body below this pivot point. So it's kind of like a teeter-totter, so you can rotate either way. Now you can rotate either way by moving one or both arms back. And after you've inverted for a little bit, your body may have stretched or elongated, and so that when you come up, you might not come all the way up. So to help that out, all you need to do is slightly bend your knees, and then you'll slide down, and you'll be back up into the upright position. If you lay back on the table with your arms on your chest, and there is no movement of the table, this means that you have an incorrect passive setting. So what you'll need to do is step off of the table and reset the adjustable boom by decreasing it by 1 inch. Next, we'll demonstrate a rotation that is too aggressive because the adjustable boom is set 1 inch too short. So if you rotate back very quickly and without using your arms, you know that the settings are not correct. So to fix this, you'll need to lengthen the adjustable boom by 1 inch. Now you don't have to totally invert to achieve benefits from your inversion table. Many people won't go past a 45-degree rotation. So go at your own pace and do what's best for you. Now to get the table to totally invert, you first need to make sure that you disconnect the nylon strap from the main frame. Next, your pivot arms need to be in the top setting. And then also make sure you have a spotter present to help you out. Now it's easy, just like before, you just take your arms back one at a time, and then your body will rotate so that you're into total inversion. You can use your hands to maneuver you once you're down in this position, and make sure that your back isn't touching the back of the bed frame. Now make sure you practice good deep breathing while you're doing this. And there are a lot of different athletes that use gravity training, allowing them to train their inner ear to adjust to being upside down. Skydivers, gymnasts, or any aerial athlete can use the total inversion to train their bodies. To return from total inversion, all you need to do is place your hands onto the handles, one at a time there, and then assist yourself on the way back up. Now you'll want to stop in the horizontal position and rest there for a few moments so that you don't get dizzy on the way back up. And then when you're ready, you've got your hands placed at your side, bend your knees slightly, and your body rotates back up to the upright position. This is a common question. You should pick an angle that's safe for you. Your body may be most comfortable at a 45-degree angle. Make sure you stop whenever you feel any type of discomfort. Extra blood flow to the head occurs the first time you use your inversion table. It's good for you and it's healthy. Oxygen washes throughout your body with increased blood flow. You'll get used to this feeling and enjoy it more and more. You should invert for the amount of time that's comfortable for you. You might start out with 1 to 2 minutes and then build your way up to maybe 10 or 15 minutes. The motto, no pain, no gain, does not apply to your inversion table. The maximum weight is 300 pounds and the maximum height is 6 foot 6 inches. It's very good to move back and forth while you're inverting. It promotes blood, lymph, and spinal fluid movement. Now, you can also move from side to side to help you relax even more. To truly benefit from using your inversion table, just take a deep breath and relax. Now, good luck and enjoy your new LifeGear inversion table.